In this video, we'll discuss about acute pyélonéphritis. What is acute pyélonéphritis? It is a acute. In this video, we'll discuss about acute pyélonéphritis. Acute suppurative inflammation of kidney which affecting renal tubules, interstitium as well as renal pelvis. So what is acute pyélonéphritis? It is a suppurative inflammation of kidney which affecting renal tubules, interstitium and renal pelvis. Etiopathogenesis in acute pyélonéphritis. Important etiology, it's ascending inflammation. That is when there is urethral colonization. When there is urethral colonization by example bacterium E. coli and Proteus, there will be stasis and obstruction. When there is urethral colonization by bacterium like E. coli and Proteus, there will be stasis and obstruction. Because of obstruction and stasis, there will be there is incontinent visco-urethral wall or reflux. So here there is incontinent vesico-urethral wall or reflux. There will be intrarenal reflux, IRR, intrarenal reflux from urethral through the bladder. The urine reverse back. There is retrograde flow of urine into the kidney due to urethral colonization. Stasis and obstruction. Obstruction in component vesico-urethral wall reflux and intrarenal reflux. This IRR, intrarenal reflux, it is a condition that occur when urine flow backward from the renal pelvis into collecting duct and tubulo-intestinal interstitial tissue of that nephron. So here what is the thing? Ascending inflammation. When there is urethral obstruction, urethral colonization by bacterium, there will be stasis and obstruction. Because of that obstruction and stasis, there will be incontinent vesico-urethral wall or reflux. There will be intrarenal reflux. From urethral through the bladder, the urine reverse back. There is a retrograde flow of urine into the kidney due to urethral colonization, stasis and obstruction. There is ascending inflammation most commonly causing organism E. coli and Proteus. Next etiology is due to hematogenous spread. Second one is because of hematogenous spread through the blood. This occur due to bacteremia. Sepsis and septic emboli. Next, that obstruction due to renal calculi or stone or stasis. So next to obstruction is due to renal calculi, stone and stasis. So four main etiopathogenesis are most common in ascending inflammation. Second one is hematogenous spread, then obstruction or stone. Lastly, status of urine. Ascending, inflammation, infection, hematogenous spread, obstruction. Lastly, status. Next, predisposing factors of acute pyelonephritis. This one include chronic cystitis, urolithiasis, recurrent UTI, urinary tract infection, then neurogenic bladder, catheterization, instrumentations, then benign prostatic hyperplasia. These are the predisposing factor for acute pyelonephritis. What are the condition? Chronic cystitis, urolithiasis, recurrent urinary tract infection, neurogenic bladder, then catheterization, instrumentation, benign prostatic hyperplasia. Next, morphology of acute pyelonephritis. Crossly, the acute pyelonephritis can be unilateral or bilateral. There will be focal abscess on subcapsular surface. There will be focal abscess on subcapsular surface. It is most commonly seen in upper and lower pole of the renal pelvis, renal calyces as hyperemic. They are covered by fluorescent exudates. So this one, there will be focal abscesses on subcapsular surface and most commonly seen in upper and lower folds of that renal pelvis and renal calyces as hyperemic. They are covered by fluorescent exudates. Coming to microscopy, microscopy shows patchy interstitial infiltration of neutrophil. So that microscopy shows patchy interstitial infiltration of neutrophil in that interstitium. As acute inflammation, there is infiltration of neutrophils. Next, intratubular neutrophilic aggregates forming abscess which further leads to tubular necrosis. Intratubular neutrophilic aggregates forming abscess which further leads to tubular necrosis. The glomeruli appear normal in microscopy. Patchy interstitial infiltration of neutrophil. Glomeruli appear in normal. Coming to complications of acute pyelonephritis, there are three main complications: papillary necrosis, pyelonephrosis, perinephritic abscess. First one is papillary necrosis. There will be necrosis at tip of that renal papillae. There will be necrosis at the tip of renal papillae. It is seen in diabetics patient with urinary tract obstruction. It is seen in diabetic patient with urinary tract obstruction. Microscopically, there are coagulative necrosis. Microscopically, coagulative necrosis. Second one is pyelonephrosis, that is accumulation of pus within the renal pelvis, renal calyces and ureter. Renal pelvis, renal calyces and ureter. That is pyelonephrosis. Next, perinephric abscess. Perinephric abscess develop when suppurative infection break the renal capsules. Develop when suppurative infection break the renal capsules. Clinical features, it include sudden pain at costovertebral angle with fever and malaise. Also, costovertebral angle with fever and malaise. Also, presence of this dysuria, frequency and urgency of urination. Then urinary binding in the case of acute pyélonéphritis, microscopically presence of pus indicate there is pyuria. Next, presence of WBC cast in that urine indicate renal involvement. There is pus, it is pyuria, and if there is WBC cast in that urine indicate there is renal involvement. So this is all about acute pyélonéphritis. This video discussed acute pyélonéphritis, etiopathogenesis, 4 way of spread, ascending, then hematogenous, then obstruction because of stone and calculi, then status. Then predisposing factors, microscopic, crossly unilateral and bilateral. Then complication, papillary necrosis, pyelonephrosis. Then perinephric abscess, clinical features, then urinary binding, presence of puzzle, pyuria, WBC cast, renal indicate renal involvement. Thanks for watching.